So we'll get started in just a minute or two. Give people time to get in. Meantime, those of you who have joined us, if you want to just put in your chat where you are tuning in from. It's always interesting to see where everyone's coming from. We're checking on whether the chat is enabled.
It should be, but if they're having issues, why don't we have them put that in the Q&A?
Good.
And that way they know where to put their questions as well.
Thanks, Phyllis. Still did, oh, but there we go. Using the Q&A like chat for the moment. All right. I'm going to go ahead and get started and welcome everybody. We are delighted to have Dr. Hannah Rose Mitchell with us today to talk about caregiving and the stresses that come with it and some tips and strategies to help make life better. Before we get into that, we're going to just go through a few things about the session today and who we are, and then we'll jump into her presentation and questions afterwards. I'm Jean Pudlow. I'm the Interim Executive Director at Erdheim-Chester Disease Global Alliance, and happy to be with you today. We thank Global Genes, Rare Mental Health Initiative, for the grant that allows us to have Dr. Mitchell here with us today, and other work that she's done with us on supporting our virtual chats and the training for the volunteers for that. We're grateful to Global Genes for that grant, and appreciate too our co-hosts today, the Histiocytosis Association and the Histiocytosis Association of Canada. Yeah, with that, I will go ahead and let Deanna from HA introduce herself.
Thank you so much, Jean, and thank you to the ECD Global Alliance and to Dr. Mitchell for this amazing opportunity. Really appreciate it. So the Histiocytosis Association is dedicated to supporting all histiocytic disorders, and we do that through education, emotional support, and fund research leading to better treatments and a cure. My name's Deanna, and I'm Executive Director and an LCH survivor. And again, I just want to reiterate how grateful we are for the opportunity to partner with such amazing organizations and individuals for the Histio community. I'll pass over to Claudio.
Good day, everyone, and thank you for joining. Thrilled to be part of this and thrilled to be part of the sponsorship program today. The ECD group, thank you to them and the HA. We are a small group in Canada built on just a few volunteers that, again, trying to follow the footsteps of the HA Association in the US to evangelize on behalf of our community, our caregivers, as well as our patients and families, to look for ways to enhance the advocacy across the various media streams, and obviously to evangelize for patient care as we go through the process here in Canada. We're a fairly new organization. We look forward to these types of conversations, and I'm going to hand it over to Belinda now.
Thank you, Claudio. Hello, everyone, and thank you for joining us today. I'm Belinda Cobb, and I'm excited to be here with you today as the ECD Global Alliance Patient Navigator. My role as the Patient Navigator is to guide and support patients and their families through their healthcare journey. So if you or someone you know is in need of guidance and support, please don't hesitate to contact me. Thank you, and I hope you enjoy today's session. Hand it over to Jean.
Thank you. Just a little bit of housekeeping for our session here today. This is for information purposes only, and it's not a medical or psychological consultation. If you have specific circumstances that you have questions about, of course, we encourage you to talk with your medical team. We may not be able to answer all the questions, but we certainly will try to get to those that we can, and we'll follow up with other information when possible. We will be recording this and sending this out after the webinar, and particularly, of course, all of Dr. Mitchell's information will be then available, and there are also some resource information at the end of the speaker slides that you might be interested in. For questions and answers, we as our chat as well, but that will work in the question and answer feature. You can go in and see if someone else has already entered your question and like it, and then questions that are more liked get bumped to the top so that the speaker can see which are the ones that are pertain to lots of people's interests. And so when you type that in, then that gets that to the speaker, and she'll address it. So I think that's the main things we need to go over before we get started. And let me tell you a little bit about Dr. Mitchell. Anna is the assistant professor of psychology at the Furkoff Graduate School of Psychology in Yeshiva University, and in epidemiology and population health at the Einstein School of Medicine in New York City. She is a clinical health psychologist. Dr. Mitchell trained in psycho-oncology at Memorial Sloan Kettering Cancer Center, where she worked on trials examining cancer-related illnesses and distress in patients and caregivers, including an investigation specifically on Erdheim-Chester disease caregiver needs. She received her PhD in clinical health psychology from the University of Miami and a Master of Public Health from Yale University. Her research focuses on the psychosocial effects of cancer on both patient and family, particularly the traumatic impact and development of post-traumatic stress and growth. We're delighted to have her today, and we'll switch over and let her take the stand.
Thank you so much, everyone. And I'm so glad there's a nice group of caregivers here today with us, and really looking forward to presenting the information that I have to share with you today. As Jean mentioned, I am a clinical health psychologist. And by that, I mean that what I do is I study and I treat the psychological consequences of and factors that relate to physical illness. So specifically chronic diseases like cancer or histiocyte disorders. And I'll discuss in detail today that includes the impact of disease on not just the patient, but the loved ones like you or the caregivers. So there are a nice group of you here today, which really supports this idea that the effects of a disease are not just limited to the patient, but to family members and caregivers too. So we think of illness as a family problem, as underlined here on this slide. And at any stage of life, from diagnosis in infancy to middle age to older adulthood, serious illness impacts the family unit, as we'll refer to it today. So for family caregivers, you can see this caregiver here is really overwhelmed, taking on a lot of new tasks. So it's not just the distress or the sadness that can come with a loved one's illness that can really impact one's mental health, but also taking on this new role that involves many new tasks, often which caregivers might feel unprepared for. I'm often asked this question, what makes someone a caregiver? Well, we all are caregivers at different points in our life, and this can be while we're providing what's typically unpaid care for loved ones. And this can be in terms of emotional support, so lending an ear, listening to someone when they're upset, expressing love and kindness to people who are in need, what we call instrumental support, which refers to helping with nursing or medical tasks, or helping people with cleaning or things around the house, informational care or support. So this would be helping with making decisions about treatment, learning information about treatment and its side effects, finding out where you might want to get care, retaining medical information that sometimes might feel extremely overwhelming when the medical providers are sharing it with you, and even financial support. And what we've noticed happening in the past several decades, and particularly for those of us in the United States, there's been this big shift in the healthcare system where it's expected that a lot of care occurs at home. And this might allow a lot of benefits, right? So that patients can receive care at home and get out of that hospital setting, but it increasingly places a burden on the friends, the family members, the neighbors, the community members who make up the caregivers, who are responsible for many aspects of the patient's care. And again, they might feel a bit unprepared, overwhelmed. And this new role can be a big shift from normalcy, which might make you as a caregiver feel really isolated. But what's important to remember is that you're not alone. We have a nice group of caregivers here today. And the statistics, the data shows that many people need caregivers. Many people rely on caregivers, and therefore many people become caregivers. So nearly 10% of the world population depends on others for care, which is according to the World Health Organization. So we can assume that at least 10% is providing that care. And we also, it's hard to estimate the number of people who are truly serving in that caregiver role or who think of themselves as caregivers, but we can assume that there's likely around one person, at least one person, providing care in some capacity for people with illness. And in terms of what people, like who is providing care, there's some information on that. They tend to be mostly female. They tend to be providing care to adult patients. Over a third provide care to at least 2 people at once, so being pulled in multiple directions. But we all have unique experiences, and every caregiver is a bit different. You obviously know best what your experience as a caregiver is. Consequences of caregiving. All of you are here because you recognize that there are consequences of caregiving, that caregiving can take a toll on family members. And I wanted to briefly highlight the effects that we recognize caregiving can have. But I also want to mention that not all caregivers are the same. They're not a monolith. Our caregiver experiences are very different and unique. You only know your own experience best. Your caregiver experience is likely impacted by what resources you have available to you, maybe what went on before you became a caregiver, who you are as a person, your values, your relationship with the loved one that you're providing care for, and of course, the patient's illness and the nature and the trajectory of their diagnosis and their course of illness. So lots of caregiver experiences might vary. I'll even highlight later the kinds of positive experiences that may arise from caregiving. So we tend to think of the consequence of caregiving as in this form of burden, burden is something that's multidimensional. It involves many different domains or areas of life in which you experience stress or burden. And as I begin to talk through these, I want you to think about the specific areas of your life in which burden is showing up. So let's start with physical burden. So yeah, even caregivers themselves might experience physical effects of a loved one's illness. So this can be in the form of pain or pain being exacerbated, difficulty sleeping, difficulties falling asleep, staying asleep, waking up too early, or poor quality of sleep. Your immune system might be not functioning as well. You might be noticing that you're getting more colds lately. Health behaviors like diet, exercise, even substance use might be impacted as you're trying to find a way to cope. And there's even this physiological stress response. So stress hormones in our body, like cortisol, might be elevated when we're taking care of a loved one, which can then ultimately impact our health. There's also the social effects. So caregivers tend to report feeling isolated. They might even experience relationship conflict, whether with the patient or others in their life. These major social role changes. So oftentimes I'll find that caregivers will report like, this was this is my partner and spouse, the love of my life, but now I'm serving in the role of a nurse, and that can feel really disruptive. Spiritual changes. So caregivers may find that they're questioning their beliefs. Their beliefs might feel challenged, their religious beliefs or spiritual beliefs. There's financial burden. So changes sometimes even in employment status as loved ones are required to take on the caregiver role, the costs associated with treatment. Then temporal, which refers to time. So the time that you spend caregiving can actually be taken away from other responsibilities and activities. And caregivers tend to report that they feel like their time is very restricted. And psychological, which is what we'll really be discussing the most today, although all of these are interrelated and relevant, but we have anxiety, depression, the symptoms that are described in the title of this talk, and the mental health problems that we tend to see show up most when caregivers present for psychological care. Some caregivers even present with post-traumatic stress symptoms or post-traumatic stress disorder. Some might even report that they have thoughts that life is not worth living. So I want to use this metaphor here of thinking of our experience as caregivers like a well, and that when the demands of caregiving, providing for others exceeds the resources or the water that we have in the well, and the well feels like it's run dry, that's when we start to tend to notice that we're experiencing those psychological problems like anxiety or depression symptoms. So when we're feeling like we're being asked to give more than we really are ready or able to, that can be really distressing. So while we see a lot of caregivers present with anxiety or depression, most don't necessarily have full-blown diagnosis of these things, but they tend to often have elevated symptoms, particularly during their caregiving experience. So what does anxiety look like? Well, same thing here. I want you to keep track of if you've experienced some of these symptoms or experiences, but caregiver anxiety may involve feeling really worried about all sorts of things, feeling nervous, maybe having difficulty with concentration, attention, or memory, maybe feeling these sort of physiological or physical symptoms like feeling tense, restless, like feeling like you may have dry mouth or chest pain, or muscle tension, shortness of breath, dizziness, or sweating. You may notice changes in your appetite. Caregivers or just even people in general experiencing anxiety symptoms may find that it's really hard to do the things that are important to do. They might feel like they're kind of avoiding or putting off doing important tasks or responsibilities. Those might feel overwhelming, may even feel kind of withdrawn from or avoiding people or places or things that are kind of stressful at this time. And depression also includes some similar symptoms as well as others. So with depression, you might feel more of as feeling low or down or sad, feeling hopeless about the future, feeling helpless or like things are out of your control, like there's nothing you can do. You may notice yourself crying, maybe feelings of guilt, like wish I could do more, or feel like I'm not doing enough, or feeling responsible for things in some way. Then just feeling like generally lethargic, fatigued, low, a difficulty experiencing pleasure or getting joy, or feeling interested in things, having a hard time getting going or getting started, maybe feeling worthless or your self-esteem is impacted or you're blaming yourself in some ways, and sleep may be disrupted too. And then even in some cases, some caregivers may have thoughts that life is not worth living. It's also important to note that many of these symptoms might be reflective of post-traumatic stress, which can occur in caregivers because caregivers, like the patient, are exposed to this life-threatening illness, which can then become a trauma. So, we don't necessarily need to figure out which of these it is that you're experiencing, but really rather recognize the way in which these sorts of symptoms are getting in the way of life and using that as a clue that it's time to help take care of yourself. And we'll be talking about some specific tricks for that too. And caregivers do report that they have difficulty managing these sort of mental health or emotional problems. They so often report managing that their own emotional and physical stress are a major concern or a need, an unmet need. And we see that here in these data from a large survey of over 1,000 caregivers of adults patients who were participating in the National Alliance for Caregiving study. Around a little over a quarter of the participants reported that they needed help with managing emotional and physical stress. And in fact, even in our own research, which was done at Memorial Sloan Kettering in conjunction with the ECD Global Alliance, we found that in a study of 92 ECD caregivers, around 2/3 reported unmet psychological and emotional needs during their caregiver experience. And almost 2/3 reported anxiety at levels ranging from mild to severe, and a substantial 14% reported severe levels of depression symptoms. And I wanted to also include this anonymous quote from an ECD caregiver, which I think really highlights the kind of emotional toll that the caregivers in this study and ECD caregivers experience. I wish that for people like myself who have to do this, I just wish that our society be more empathetic and try to offer more support for people who are caregivers to have more support for them. It is extraordinarily difficult and stressful, and the emotional toll is palpable. So I thought that was a very moving quote that emphasizes the emotional impact on caregivers. For caregivers, distress, so meaning anxiety, depression, or even post-traumatic stress, can show up at any time. So it's normal to experience these at all different illness phases or all different parts of our caregiving experience. It tends to increase over time. It can even manifest after the completion of treatment, whether entering a survivorship period or hospice or even in the bereavement phase. So it's normal to expect to see distress at any phase. Some of these periods, it's really critically important to be aware of how the caregivers may experience distress and expect it even long after treatment is completed. So sometimes when we experience these psychological consequences of caregiving, it's really uncomfortable. And emotions and experiences start to become really clouded. It's hard to sit with some of that discomfort or that pain. We're also juggling many, many different tasks and demands. So it's hard to see the areas in which we have the greatest needs, what we're really feeling and why, and how we're choosing to live with those feelings. So I encourage you, again, going forward, to think about the types of symptoms or experiences that I've mentioned and how they resonate with you. And then take stock of what you're doing to cope and how you're managing those sorts of difficult feelings. Again, I'll emphasize this idea of anxiety, depression, stress, burden popping up when the demands of our caregiver role exceed our resources, when we're asked to do more than what we feel we have the capacity to do. Oftentimes because we're unprepared or because we have some other metaphors to really think about this. I start with this idea of finding buckets to fill to help identify what needs caregivers have. So when you think about the areas in which you feel burdened, so whether that's these kind of psychological areas we're talking about, or your physical consequences, maybe not taking care of your physical health, or spiritual health, or noticing financial and time impact, what we need to do is take a look if there are any buckets that can be filled. What areas are there room to add a little bit more resources to? How can we prioritize and juggle? It tends to feel impossible to add any resources to any of these things. We might not have access to things. Time is limited, right? There's only 24 hours in a day. But when we look at these specific areas that are impacted by caregiving, you might be able to get some more clarity about what your needs are. So I want you to think about starting really small, just think adding drops to that bucket, not trying to fill buckets all the way up. And another kind of metaphor that illustrates this is the idea of juggling both rubber and glass balls. So glass balls being the most precious things in our lives, perhaps family or health. And when we're juggling too many balls, we do need to drop some. And it will be the rubber balls that will drop. So caregivers might want to take a look for responsibilities that we are letting go of for the time being, and remembering that those rubber balls can bounce back like a rubber ball, right? And have acceptance with yourself as you do so. So sometimes it can feel really hard to let go of responsibilities, to let go of important areas of our life, whether that's keeping in touch with friends, keeping up with housekeeping, responsibilities at work. But in this time of need, when we really need to take care of those glass balls, it's okay to drop some of those rubber balls. Also, when we have too many balls in the air, we may get this sort of frantic and overwhelming sense that every single one of them is a glass ball. So this is why I'm asking everyone to sort of zoom out and kind of take stock in different priorities and recognize, what's happening. These balls are coming at us from all different directions, but we don't need to prioritize catching every single one. So think a little bit about what might be top priorities, glass and rubber balls, what you can let go of for time being as caregivers, and how you can accept that. And one of the most critical skills for caregivers tends to be asking for help. I really want to emphasize here today how important asking for help is, how asking for help is smart and it's not selfish. Even though sometimes it might feel like it's selfish, it's not. And asking for help requires you to be really honest with yourself and with others. Ask yourself, how full are your buckets? What balls are you dropping that you might need someone else to catch for you? In terms of some practical strategies for asking for help, think about what you need, recognize what you need and what you're asking for, and be specific. So perhaps you have this kind of time or temporal burden, and that might mean that it will be helpful to ask a neighbor to pick up a few items from the store for you, or ask someone to help with some tasks that you're juggling. Maybe you're noticing the physical burden. Can you ask someone to help take care of your loved one while you get out for a walk, or ask a friend to accompany you for a walk for some exercise? Starting small. So sometimes it can feel daunting to ask for help, or we fear rejection when we're asking for help. So maybe just test the waters at first and think about asking for something really small and seeing how different folks might respond to that. Offering choices. So help can come in many different forms. Family and friends might not know where to begin in terms of helping you, and you might not know what others are willing. I find this comes up a lot with caregivers with whom I work. It's that they hear from people that they are willing to help, I want to help, but they don't really find that these folks who are offering help know just quite what to do. They don't know if they're willing to help them with the things that they actually need help with. So sometimes caregivers might actually feel frustrated because their support network is offering help with the wrong things. So it's important to be honest and let those loved ones or friends or neighbors know a few of your needs and ways in which they can help. And then this final one is really key and just underlies all of this. So remember that you are worthy of help. Sometimes caregivers might feel like, as not being the patient, caregivers themselves are not entitled to the same support. It might feel really funny to be asking for help as a caregiver when it's the patient who's the one in need who requires care at this time. But remember, you're part of this unit of care that I described at the beginning today. So caregivers are affected by a loved one's illness too, and it's critical that they are cared for as well. On that note, I want to emphasize how important the caregiver is in that unit of care. when I work with caregivers in psychotherapy, we consider caregivers as the patient themselves, right? So we want the caregivers to be empowered to take care of themselves, to recognize the unique needs of caregivers that sometimes are directly related to the patient's experience and sometimes might be more because of your own individual experience and reaction to caregiving and your loved one's illness. So it can feel funny to think of taking care of yourself again at this time when it seems the most difficult because your resources are so restricted, and it might even seem the most unimportant because you're prioritizing the patient's needs so much. But I like to introduce this metaphor time and time again here of the oxygen mask on a plane, right? So the emergency instructions on a plane are clear. It's critical to put your own oxygen mask on first so that you can then adequately help the person beside you. And if you fail to put your oxygen mask on first, you might struggle to breathe, which leaves you unable to help the person next to you. So the same thing goes for caregiving. Your own care has got to be prioritized. But again, I recognize that it can be really, really hard to engage in self-care during this particular moment in time. So we'll talk about some specific tips that I've worked on with patients with whom I've worked. So starting to think about self-care as something that can be scheduled. Your days might get filled up, you can feel really preoccupied, distracted. So I encourage you to literally schedule self-care on your calendar, just like you would with a medical appointment or a work meeting. With caregivers that I work, sometimes I'll even give a prescription for engaging in pleasant activities or self-care activities. Try to be consistent. So just like something like exercise, try to be consistent. Integrate just one activity a day. I recently worked with a caregiver who was very overwhelmed, but would feel like the days were lost, but had a nightly ritual of taking a bath and listening to a guided meditation with a Vietnamese monk, Thich Nhat Hanh. This was really helpful to them to just have that moment of winding down. So also what's important here is that if you know that you're going to have a stressful day, even though it's counterintuitive because you might not have as much time, it might be important to think about scheduling an additional self-care activity in that day and thinking of that as securing your oxygen mask. Take a real good look at what are you honestly doing to cope. Sometimes when we ask this question, caregivers will identify, I've been turning to alcohol a little bit more frequently. I've given up other things that help me with different types of stressors in the past, but this caregiving stressor and my loved one's illness has felt so overwhelming that it's been really hard to keep up healthy coping. So take a real good look at what you're doing to cope and how can you find ways to integrate healthier alternatives. Again, just like I said when I talked about sort of filling up your buckets, start super small, okay? So this could just be a 10-minute walk. What tends to happen is that people engage in all or nothing or black and white thinking. So thinking, I don't have time to work out, so therefore I'm dropping my whole gym routine and now I haven't worked out in months. And I can think of a caregiver I worked with who had been a former athlete who just wasn't exercising at all. But we recognize that maybe just going for a short walk, a 10-minute walk a day, could be significantly better than doing nothing at all. So it can be hard when you think about self-care, if you're not really able to achieve what you used to be able to achieve with self-care or what you would like to be able to achieve, it can be hard to think really, really small. But engaging in just the littlest bit of self-care can make a world of difference. And one thing I want to emphasize is that our sleep and sleep hygiene underlies all of this. So some of you might already be noticing that sleep is impacted in some ways or had pre-existing challenges with sleep. But there are lots of resources for addressing sleep challenges, improving your sleep hygiene and sleep environment, maintaining a consistent sleep schedule. So sometimes caregivers might report that the only time they have to do self-care is at night. So think about sort of like how to integrate that while ensuring a good sleep schedule and really keeping yourself rested and healthy for moving forward. When do you need to engage in self-care? Well, the answer to that is always. It's like I said, it's on the last slide. It's important to be consistent as much as possible and engage in self-care even when you're not feeling good. So this is what can be really challenging, right? So it's harder to do these things when you're feeling bad or down, but that's when you need it most. And when you really need it most, it's just consistently. There might be some hints or red flags that you're in need of more self-care. So one, do you notice that your burden is high? Do you notice that it's harder to keep up with all of your responsibilities? Do you notice anger or just more intensified emotions? Do you notice physical health problems? Are you experiencing like pain or fatigue? Are you getting sick more often? Do you notice that you're engaging in less healthy activities? Another major red flag that can clue us into the fact that we need self-care can be guilt. So caregivers might feel guilty for taking time for themselves. Well, that actually means that you probably need a little bit more time for yourself to restore. It can be really difficult to find the right time to do this. And what happens is, like I said, it's hard to find the time that you'll feel up to it, that you'll feel ready for it. So I want you to think about it as taking an action until you feel better, or acting into feeling, rather than waiting to feel better so that you're up to it. So like if you're trying to go to the gym, for example, you might think, oh, I'll go to the gym when I feel ready, when I feel up for it. But oftentimes we won't get to that point without actually doing. So what we want to think about is just how to engage in those activities even before, or in order to feel, to start. There's no time like the present. And a final self-care tip that's really important to a lot of the work that we do with caregivers, and particularly for anyone experiencing anxiety or depression, is engaging in mindfulness and relaxation exercises. So there's all sorts of tools available on the internet for how to engage in mindfulness. It can be really challenging at a time where your mind is pulled in lots of different directions. But what I want you to think about is using breathing, using your breath to induce a state of calm throughout your body. So I'll leave you with just this one skill here for relaxation training, right? Because our bodies tend to carry a lot of the stress that we experience, especially during caregiving. So the breath can be a really simple tool that you have access to at any time. So maybe after receiving upsetting news, when we're feeling as though we're in peak worry about something, maybe when like we're just noticing that we're in stress of something like traffic or everyday daily stressors. It also can be a practice for mindfulness that can be part of a routine self-care activity. So for those of you who aren't familiar with belly breathing or diaphragmatic breathing, what this involves would be like, you could start with placing one hand on your chest, one hand on your abdomen, and taking a deep breath in. Noticing where you feel it rise. Is it the chest or is it the belly? And the goal here would be that the belly rises when you take deep breaths. And we know that this diaphragmatic breathing can activate your parasympathetic nervous system to reduce some of the stress and anxiety that you're carrying in your body. So there's biological evidence that this is a way to sort of calm your system down in the moment. Also, if we focus our thoughts on our breathing as much as possible, this is essentially a mindfulness exercise, which is linked to improving attention and helping regulate emotion, which comes up a lot when we experience anxiety and depression. So while I know quite simple in the scheme of things, it is one tool to just bring with us throughout our days, keep it in our back pockets. And finally, for the last part here, I really think it's important to highlight that in a lot of the research on caregiving we see that while caregiving and dealing with illness in the family involves intense suffering. It can be really painful, frightening, intensely involving negative emotions. Not all caregiver experiences are harmful or detrimental. And that even when having a very stressful experience, it can be possible to have positive outcomes, to have some growth from caregiving too. So I want to talk a little bit about finding benefit and making meaning from caregiving as I wrap up today. So we have this term that's called benefit finding that describes the experience of having positive outcomes after adversity or in the face of adversity, like caregiving. One of my mentors at University of Miami conducted this study and identified these different areas in which caregivers experience meaning or benefit finding. In this case, it was after a loved one's cancer diagnosis. So starting with some acceptance, there can be an increased tolerance of the sort of crises that we face, an increased tolerance or acceptance of distress, and learning to live and step forward in spite of those feelings. Caregivers may notice enhanced empathy. So this empathy might be directly towards that patient for whom a lot of our actions are driven by empathy. It may be for others, right? Just noticing enhancement of these feelings of empathy. Appreciation or gratitude. You can think of a caregiver I recently spoke with who shared how immensely grateful that she was for her children's health, for her own health, in the face of her husband's suffering. Family relationships may be strengthened. Sure, they may be challenged, as I've mentioned earlier, but a new appreciation for family may be highlighted at the same time. Positive self-view or caregiver esteem. A lot of caregivers report feeling proud of themselves, the role that they play in their family, what they offer others. Sometimes they're the glue holding the family together. And as challenging as that is, and as that creates a lot of anxiety and depression and burden that I've talked about today, that also can give caregivers a sense of pride or self-esteem. And finally, reprioritization. So caregivers might notice that the crisis of experiencing an illness in the family requires them to really think about what matters most to them. So this is back to the idea of like the glass and rubber balls, right? So you're required to really focus on health and family, maybe your spiritual views or other important priorities in your life. So this sort of crisis requires folks to really think about what matters, what provides meaning and purpose in life. So I mentioned a study that we conducted that revealed anxiety and depression symptoms, unmet needs in ECD caregivers. In that same study, we found that those caregivers had the capacity for this benefit finding and this meaning making, especially those with more social support or those who had more confidence that they were getting information about their loved one's illness. They had more capacity for those things. But across the study group, we found that many folks reported benefit and meaning making. And I wanted to end this part of the presentation today with these two quotes in the words of these wonderful caregivers who participated in this study. So they shared the ways that they sought to move forward, to manage the suffering that they are experiencing, and even make some meaning or derive benefits during this crisis. The first caregiver said, "You realize it's going to be two things. You're going to either just live each day and enjoy yourself or crawl up in a ball and you don't live. That was not an option for us. So I said, I have 4 kids. They're going to have a normal life and we're going to be very truthful with them. So that's it." Another caregiver shared, it's something good will come out of this. That's how I always try to keep that positive outlook. Something good will come out of this. I don't know what. It'll come, something will happen. I don't know, wouldn't you want somebody else to benefit from the fact that you had this experience, whatever you went through? So you can see how these caregivers really are seeking to make some meaning, to manage the suffering that they're experiencing in their life, and even to an extent derive some benefits. So I'll stop there and allow time for questions today.
And we'll take about 10 to 12 minutes here for questions. And I see that we have one in the Q&A at the moment there. It's a couple people introducing where they're from, but Hannah Rose DT, David Long's comment there.
I do, yes. So David added to the chat, I find that the caregiver anxiety symptoms to be more present, severe after the death of a spouse rather than when being a caregiver to a spouse, comments. Yeah, so thank you, David, for raising this question. I think that we see that a lot. So I introduced that sort of timeline of when caregivers might experience depression, anxiety, and we see that it peaks often after the loss of a loved one. Sometimes when we're in the caregiving experience, we can be so sort of distracted by responsibilities. So I really emphasize this idea today of feeling burdened, feeling pulled in a lot of different directions, but it's oftentimes not until the death of someone that we really are in touch with those sort of anxiety symptoms. So to that end, that requires taking some time to make meaning out of the loss, or maybe even reflecting on the caregiver experience as a way in which you showed love and honoring legacy of that person. But David, I would say that you're certainly not alone in that. Those anxiety symptoms could feel really exacerbated after a tragic loss.
I have a question. This is Jean again, and I really liked your comparison of the rubber balls and the glass balls, right? That the glass balls are things you have to keep in the air because they're going to shatter, and the rubber ones will bounce back. Can you give us just some more maybe examples of that? But also, when it's really stressful during that time, it can be hard to distinguish which are which. Do you have any thoughts for people as they're trying to figure out really what's critical and what it feels like you have to do it all still? And how do you decide what's going to bounce?
Yes. So that's the big challenge there, right? And I think I sort of described that there's this frantic sense of everything feeling really important. It can be sort of hard to sift through when we have anxiety, right? So anxiety gets in the way of us being able to really think clearly about things. It can feel quite overwhelming. So sometimes that can sort of involve taking a step back or talking to an objective person or a friend or loved one about what the responsibilities are in life and how can we sort of reprioritize and identify other folks to help with certain things. Part of what I wanted to really emphasize with that example is that it's okay to sort of accept that some things might be let go, right? So like that maybe you might fully drop some responsibility, and that might actually be a problem. And so that might create like a mess around the house, or someone else might have to pick up for you at work in some ways. But allowing some acceptance and some peace with yourself when those things happen, and recognize that, ultimately you can get back to a place in which you can manage or catch some of those balls. Or another thing you can do is certainly ask for help, as I emphasized in the slides that followed that.
Thank you. We have a question. How can you make calm a caregiver as an ECD patient?
So I think this question is asking, like, how can the patient provide support to calm the caregiver? So that's a great question. I think that oftentimes caregiver or patients will feel in some ways kind of maybe feelings of guilt or responsibility in some ways, even though things are completely out of their control. And I think thinking about the things I talked about today, right? So like the sort of self-care and how important it is to prioritize that, and just acknowledging and validating that the caregivers might have their own sort of experiences, their own feelings of worry or sadness, their own feelings of stress, and letting them know that you recognize that you see that. A lot of times caregivers don't necessarily feel seen in that sense. And to like let them know that you see that and that you are prioritizing or encouraging them to address their own self-care too. When I think about caregivers that I work with, they often don't want to burden the patient. They don't want the patient to know how stressed out they are. So sometimes they'll be sort of concealing that from their loved ones, but letting them know that they're seen, or even expressing gratitude or appreciation sometimes can be really critical.
Thank you. There are two more questions in the there if you want to address one at a time.
Okay, all right, so I'll start with this top one. My older sister is currently the main caregiver for our mom who has ECD. They live in Tucson and I'm in San Diego. How should I recommend that my older sister take time to self-care when it seems to me that she doesn't know how to do so? I've offered help, but not sure what she really needs because I feel like she doesn't even know it herself at times. So that illustrates something that, I was trying to get at a little bit today that I think comes up all the time. It can be really hard to sort of shift and distribute responsibilities between different people. So sometimes with the offering help, people just don't know where to begin. And in that case, so I don't know your sister or like what exactly that looks like or what she could benefit from. But letting her know that, like, even that, you attended today's presentation and that self-care for caregivers was emphasized as critically part of the caregiver experience, or part of, or that we know that we see anxiety and depression in caregivers that can get in the way of their own life and even in the way of care for the patient at times. So sort of letting her know that you have this information, I think could be helpful. And asking or in helping her to identify what it is that she needs, I think could be really important. So letting her know that it seems like you might not know exactly what you're looking for support here, but let's talk through it. What are some ways in which I can help or others can help? Because sometimes it might involve thinking out of the box and it might require a little bit of brainstorming. Okay. The next question is, my husband's siblings often thank me for taking such good care of their brother. I find that this is somewhat insulting. I'm not a hired caregiver for the family taking care of their brother. I am a member of this family taking care of my husband that happens to be their brother. Am I being oversensitive? How can I respond without being snotty? Lately, I just do not respond and it bothers me, but I let it roll off my back. This, I will say another one, you are not alone here. I heard this from caregivers a lot. That sometimes that people's responses to them, other family members, extended family members, like might respond in a way that feels dismissive or invalidating, not recognizing the toll of the experience on you as the caregiver, not recognizing how you really view this duty as, or what's motivating you, that it's, out of love and familial responsibility. So no, you're not being overly sensitive in any way there. I think that that's a challenge that a lot of caregivers face. So, without really knowing too much about this, I'll be cautious to respond in terms of, how you specifically can respond without being snotty. But I think I really want to acknowledge here that can be uncomfortable to hear. And it might be helpful to talk to others in your life or in your network, or about how to navigate some of those relationships that feel a bit dismissive. And also just recognizing, what you said here, that you're a member of this family taking care of your husband. Like, I think it sounds like to you, there's a value here, that there's some love and, like I said, familial responsibility that's part of this. And that's really meaningful, despite how others might perceive it or how they might respond about it. And also, I'll finally just say that, again, I don't know your husband's siblings, but it can often be the case that, like I said earlier, people don't know quite what to say or how to help. And that might just be like how they're navigating that. So it sounds like there's some you'll be a benefit from taking some time and space to think about how to approach those interactions.
just thought of an example to share. When I was caring for my elderly mother and she was going down, my siblings were all far away, and they were grateful for my care, but I was also a little resentful that they weren't helping. And I told my brothers, if you would just come a weekend per quarter, spend the weekend with us, spend time with mom, I would know she has someone with her. And it was just so good for everybody because they felt they could contribute, and and it took something off me for a little bit. So that kind of, maybe seeing if the brothers want to get involved in some way.
Right. And then certainly the way, like I kind of just ended with, the way that they're providing that feedback might be their way of thinking they're getting involved. But yeah, these types of family dynamics can be really complicated, and the burden of care tends to fall on a small group of people. It's usually there's a primary caregiver or just a couple of people who end up taking up a lot of the care, despite that there might be many people in the family.
I just want to ask if there are any other questions that people would like Dr. Mitchell to address while we have her to brainstorm with you. Okay. Well, I'm grateful for all of you to attend. We just wanted to share a little bit of information. First of all, thank you, of course, Dr. Mitchell, for your time today and for preparing this presentation. I know I really appreciated the bigger picture of understanding when you're in a role of caregiving, what are the dynamics that are going on that you can't identify necessarily when you're going through it. And I hope that's been helpful to people who have seen this and will see this later. Okay, so we have just a couple things to first to let you know that on November 16th, Dr. Mitchell will be doing another chat geared towards patients with histiocytosis, so geared towards adult patients with ECD and other diseases. So I invite you to take a look out for that. And before then, we've got some other things going on. So Belinda, if you want to talk about the ECDGA.
Yes. Okay. ECDGA is excited to invite you to our upcoming caregiver chat, which is on Saturday, October 14th at 1 p.m. Central Time. The chat aims to provide support, tips, and platform for open discussion. So please remember to register. You may register through our website, this QR code on the screen, social media post. You should be getting an email. So we have different ways of registering. We look forward to connecting with you and sharing in this important conversation. So please join us. Thank you.
And next slide, and Deanna. Oh, we got those.
And thank you, Dr. Mitchell, for the really enlightening and informative talk. I learned a lot myself, and it's just wonderful to have the conversation about the caregiver's experience. So there's just some information on the screen about some of the programs that the Histiocytosis Association has, including a student scholarship program and webinars and videos, peer-to-peer support groups, and grief groups. I do want to call attention to our Patient Family Conference that's coming up on September 23rd at Memorial Sloan Kettering Cancer Center. That's in New York City from 9 a.m. to 3 p.m. It's in person and online as well. And all histiocytic disorders will be covered, as well as pathology and well-being. So hopefully we can see you there, and I will pass to Claudio.
Great, thank you. Thank you, Dr. Mitchell. Thank you for the team for the ECD Alliance. Thanks for having us on. Terrific presentation. I'd like to just end the presentation before handing it back to Jean for close off. As I said, we're a small organization based out of Canada. We strive to service our constituents accordingly through Physician Finder, establishing volunteer programs, as well as grant research initiatives. So I'd like to direct you to some of our social links, and handing it back over to Jean for closure.
Great, thanks to everyone. We will be sharing the slides, as I mentioned before, and this will be posted on our website. Well, we'll let you know when it'll be on there, probably another week or 2 or 3. So you can see it again or share it with your friends who couldn't make it today. And I think that's it. Anybody else? thank you for coming. Appreciate it, and would love any feedback that you might have. So feel free to email us on that. All right.
Thank you, everyone.
Thank you.
Yep, we got some thank yous in there, and it's down to us. Nope, 2 more participants still there. All right, thank you, Rachel. Things went smoothly. Appreciate it.
No problem. See you in a few.
Okay. Take care.